At the age of 15, I never got my menstrual cycles. My mom took me to the doctors and we discovered that the uterus never fully formed. I had MRKH, which was something that affected 1 in 5,000 women. They told me that I would never be able to carry my own child. My mom had mentioned uterine transplant, and I just decided I was going to look it up. The doctors told me that there were some risks involved, including rejection of the organ. And even though I was going to get this uterus, it doesn't necessarily mean that I would be able to carry baby.
That was Chelsea, who recently received a uterus transplant and delivered a healthy baby boy, but with the help of an anonymous organ donor, now turned soul sister, Cheryl. But just how can such a groundbreaking medical miracle even happen? Well, we're bringing in lead investigator for the Penn uterus transplant trial, Dr. Kathleen O'Neill. Dr. O'Neill, thank you so much for joining us.
Hi, Dr. Orden, Dr. Landry, thank you for having me.
Tell us, how common is this in the transplant world?
Well, the first transplant was in 2013 in Sweden. And the first baby was born there in 2014. And since that time, less than a decade, there have been 30 transplants about in the United States and about 70 in the world. So it's still not common.
Dr. O'Neill, explain for our viewers, how do you determine a match?
When we say Chelsea and Cheryl were a match, we're talking about really two things. First, we're talking about their blood types were the same. And then also they were what's called they had a negative cross match, meaning that the antibodies in Chelsea's blood would not react negatively to the Cheryl's uterus.
And this is not a surgery for everyone. So can you talk a little bit about how someone can qualify to be a recipient like Chelsea?
In our trial specifically, we are focusing on individuals who were either born without a uterus or had their uterus surgically removed. And it's more common than people think.
Yeah, because I think a lot of people are probably watching and saying, oh, I had a hysterectomy, but this surgery is very different from a typical run-of-the-mill hysterectomy.
Yes.
It's very different.
Yes. This is not the hysterectomy that your mom or your neighbor had. The typical hysterectomy takes about 2 hours.
Yeah.
And Cheryl's hysterectomy took about 14 hours. So this is what's called a modified radical hysterectomy. And I do not do the surgery. A team of 100 individuals does the surgery. So what we do is we take the uterus out. And unlike the standard hysterectomy, we need to keep the blood vessels, the arteries and the veins intact and in good condition, because we need to use those to keep blood going to and from the uterus when it's put into our recipient, in this case, Chelsea. So in all, it takes about 14 hours to do the first part of the hysterectomy, and then we have to turn and do the recipient surgery.
Okay, so as far as recipient surgery, you reconnect the arteries and veins, right? And I guess you have to make the connection to the cervix, correct?
We do. We connect the top of the vagina from the donor to the top of the vagina with the recipient. So the cervix then has an opening where the blood can come out and where we can put the embryo in when we are doing pregnancy attempts.
How cool is this, Anita?
It's very cool. And the reason that you're not connecting the fallopian tubes is because of the amount of scarring that you could encounter, and as a result, that could increase the risk of an ectopic pregnancy, which is a pregnancy outside of the uterus?
That's exactly right. That's what some of the animal studies had shown, that a lot of scar tissue can occur after these surgeries, and so the fallopian tubes are not functional. And also, when we do this, we use the blood supply sometimes to the fallopian tube to help with the uterus.
This is so cool.